Hello dear friends and colleagues from around the world. My name is Dr. Uliana Gut and welcome to Lamb Clinic in the heart of Harley Street, London. And I want to talk about different treatment recommendations and combinations because often our patients have other treatment modalities. So when it comes to managing hyperpigmentation, whether it's melasma, solar lentigines, whether it's post-inflammatory hyperpigmentation, we often use a multimodal approach. So sun protection is very important, topical treatments, creams, then you have your lasers, you might have your chemical peels, and of course you may have systemic treatments also. Now, I just want to hone in on this slide. So skin intellectuals have really wanted us to explore this concept of melasma treatment recommendations. So this is a really interesting table showing that actually for melasma, there is a plethora of multimodal topical applications. So for example, triple combination, 4% hydroquinone, you've got your retinoic acid and your fluocinolone combination. So this is type A grade recommendation. You've got your hydroquinone, typically used 4%, retinoids, of course, different types of vitamin A, glycolic peeling agents, exfoliants, azelaic acid, kojic acid, niacinamide, TCA, salicylic, and other exfoliating agents. So actually in the treatment of melasma, it's not just a unimodality, but you can mix and match different treatments because it's a chronic condition. Now, we want to hone in on the Skin Intellectual Depigmenting skincare program. The Skin Intellectual bleaching microemulsions don't replace the standard prescription treatment for melasma and hyperpigmentation. They don't. They are an adjunct. So it's the skincare by Skin Intellectuals is formulated to increase the permeability of active ingredients and targeted activity. So you've got your Skin Intellectuals Hyalosphere technology, so that allows for more targeted treatments. Now, the balanced concentrations in these products and increased penetration in Skin Intellectual microemulsions allows us to achieve excellent clinical results. Now, the primary depigmenting treatment with Skin Intellectual microemulsions can be used in mild to moderate cases of hyperpigmentation, as well as maintenance therapy after melasma treatments to support their clinical effects. Now this is interesting. This is really showing you how to combine the Skin Intellectuals products. So if you have, for example, mild to moderate and moderate forms of pigmentation. So you can take a look on the left, your mild forms of hyperpigmentation, you can combine your retinol 0.25, niacinamide 10%, and you can actually combine it with glycolic acid 7% tonic. For mild to moderate forms of pigmentation, we recommend retinol 0.25 plus niacinamide 10%, plus even something like arbutin, alpha arbutin at 2%. Now, if you're dealing with moderate forms of pigmentation, get your retinol 0.25, your azelaic acid 10%, and then combine it with alpha arbutin 2% and niacinamide 10%. So you've got 4 products there. Now, when it comes to using morning and evening routines, patients often get confused. So let us make it simple for you. You can print this out for your patients. In the morning, a patient with mild forms of pigmentation might start with the Skin Intellectual glycolic acid tonic, and after 15 minutes, put your niacinamide 10%. And in the evening, if you have mild pigmentation, you start with your glycolic acid tonic, and after 15 minutes, you use your Skin Intellectual's retinol. Now, if you're dealing with slightly more pigmentation, your mild to moderate hyperpigmentation, well, why not start with your glycolic acid tonic in the morning, and after 15 minutes, your arbutin 2%. And in the evening, go again with your glycolic acid tonic, and after 15 minutes, start your retinol. But if you're dealing with very moderate forms of pigmentation, go with your glycolic acid tonic in the morning, 15 minutes after you put your azelaic acid 10%, and in the evening you actually go straight into niacinamide 10% combined with retinol. So very easy protocols for you to share and print with your patients. Now, often people ask about, well, what happens if you want to use lasers or chemical peels? So let us deconstruct this for you. It's super easy. Whether you have an ablative laser, non-ablative laser, or a non-ablative laser in your clinic, this is what we recommend. So have a look on the left. With ablative lasers, Skin Intellectuals recommend retinol 0.5 to 1% for 3 months before the procedure, and you stop the retinol 24 hours before the procedure. Then you can restart retinol at 0.5 to 1% and combine with Skintellectuals, ascorbic acid or niacinamide if necessary after the procedure to maintain the results. Now, if you have non-ablative lasers, then pre-procedure Skintellectuals recommend retinol 0.25 to 0.5% for 3 months prior, and you stop 24 hours before procedure. And then after the procedure, you obviously want to get the maintenance, so you continue with your retinol 0.25 to 0.5, and you combine it with ascorbic acid or Skintellectuals niacinamide. That's a nice combination. Now, for people with severe hyperpigmentation and photoaging treatment protocols, Skintellectuals recommend retinol 1% for 3 months, stopping 1 day before procedure, and then continuing after with retinol 1%, combining with ascorbic acid if necessary. Now, when it comes to the world of chemical peeling, it's very simple. Your superficial peels, Skintellectuals recommend retinol 0.5 for 1 month use pre-peeling, and you stop 24 hours before the procedure, and then you continue with retinol 0.25 to 0.5 after for maintenance, and you can combine it with depigmenting microemulsions if you like to. For medium peeling, Skintellectuals recommend retinol 1% for 3 months prior to the peel, stopping 24 hours pre-peel, and then after the peel you continue with your retinol 0.25 to 0.5 or sometimes even 1%, depending on tolerability, and you combine it with the Skintellectuals depigmenting emulsions also. Now, for those people who are suffering with severe hyperpigmentation photoaging treatment, this is what we recommend for deep peeling. So you've got your Skintellectual retinol 1% plus niacinamide 10% for 1 month before the procedure, and you stop 24 hours before, and then afterwards you continue with the Skintellectuals retinol 0.5 to 1% in combination with Skintellectuals ascorbic acid. So in summary, lots of different exciting options for you to play around with. I hope that's been useful. Any questions, do get in touch with Skintellectuals, and they're here to help. All the best, and a huge hello from London again. Take care. Bye bye everyone.